Very happy to be here in Houston again. So I think we had to start with the question of what is AI, if we're going to be talking about AI. And there have been a lot of talks about AI around here recently. So different people have different definitions of AI. And that, we find, is one of the most important problems that we have in the field. That when two people are talking about AI, they're talking about different things. And that is a real problem. Because for some people, AI is some self-conscious, intelligent machine. Well, that doesn't exist. It's probably not going to exist anytime soon. I wouldn't bet on that, given how fast the field is going, but it's not something that we have now. It's not a current problem. A second definition of AI is a set of tools for data analysis. That is what we have now. When we talk about AI now, we are talking about that. A set of tools for very complex and sophisticated data analysis. So for this talk, I'm going to be using that definition of AI, which is the AI that we have in 2025. Now, if we talk about the AI as data analysis, well, we can think about what throughout history people have done in terms of data analysis. They have multiplied numbers. They have resolved complex equations, play chess, provide driving directions, diagnose disease in medical images, write computer code, answer questions in natural language. These are all examples of different levels of complexity, of course, of data analysis with different types of data, too. Now, machines that do these things over time have received many names, from automata, electronic brains. That's quaint, but that is how we used to call them in the 1950s, computers, and now AI systems. So if we think about what is data analysis, what are the components of data analysis, we can think of three main components. First, we need the hardware and the software. Then we need a learning task. What is that we are doing the data analysis for? And third, we need resources like data and energy and water, and we put it all together. We do a data analysis, and we get a response. OK. So if we think within this framework about AI, then we can build on things that we already know about data analysis. And also, we can think about how AI is different or is not different from other forms of data analysis. Obviously, it is different in many ways, or we wouldn't be here. Here, I'm going to focus on AI for the analysis of healthcare data, I should say. But the points that I'll be making here and the discussion that we'll be having is applicable to many other things. So these are data that we have because in the healthcare system, there are interactions between patients and doctors, and there are drug dispensation, there are tests that are run, et cetera. So we have very high dimensional data on millions of people followed for many years. So what we do with this type of data, these are just two examples from our group. We take these big databases, and we answer questions like, which COVID-19 vaccine is better? Which one is safer? Or we answer questions like, OK, what is the effectiveness of a breast cancer screening program over the years? So the question that we're asking here is, can we answer this question? Can AI answer these questions without humans? Is this something that are we really needed when we have lots of data, or have these AI systems, are we needed to answer these questions? So if we think about the elements of a data analysis, we need to focus on the learning task, because the answer to the question that I pose will be different from different tasks. We argue that there are only three things that we can do with data. There are three tasks, general tasks, and each of those tasks will require different types of data and different types of algorithms, different types of data analysis. And these tasks are description, prediction, and counterfactual prediction. So description is when we use data to provide a quantitative summary of some features of the world. Prediction is when we use data to map some inputs to some outputs. And this comes under many different names. A different name is pattern recognition. And the third thing is when we use data to provide a guess of what the world would look like if something had been different. And that is also, so this is a question that starts with what if? What if this has happened? What would have been the expected outcome? And that is what causal inference is. Causal inference is when we compare two counterfactual predictions, when we compare the expected outcome if there have been screening for breast cancer and the expected outcome if there have not been screening for breast cancer. So these three tasks, I mean, we can find many examples in health research. This, for the descriptive task, which we want to know what is a 5-year mortality after a diagnosis of lung cancer, say. And there are many different analytics that we can use there. Some are very simple, like computing a risk or a mean, and some are more complicated. For the second task, for pattern recognition, there are many things that we can do, like say, find people at high risk of cancer, say. And again, we can go from a 2x2 table to a deep learning model. And for the third task, say, what is the mortality risk if everyone had received a screening for breast cancer, say. Then, again, if we have data from a perfect randomized trial, we could use just a 2x2 table. And if we have data from a complex healthcare database with time-varying treatments and time-varying confounders, we probably need to use something like the G formula or something complex like that. There's not always a sharp boundary between these tasks, because of course, if we start to describe something in men and in women, we'll start to compare and see whether there is a pattern there, whether there is an association. So we start to move into the second task from the first task, and similar when we move from the second task to the third task. But I'm not going to focus on that for now. It's also important that when we talk about AI as a tool to improve decision making, we typically mean to guide decision makers into what they decide to do. So we are talking about task 3. We're talking about, okay, I can do A or I can do B. Which one is better? So that's task 3. Even though many of the tools for AI are designed for task 2. We'll talk about that. Okay, so when I ask the question, can AI do all the things by itself? Can we just give data to a computer? It depends on the answer will depend on the task. So for description, yes. If we have data in the right format and we have a very well-defined task, that's something that the computer is going to be able to do. For the other two, it's a little bit trickier. So let's talk about that. Let's talk about the second task when we have input and output, and we want to establish a mapping between those two things. That is what pattern recognition is, what we call that with many different ways. So this is one of the earliest instances of pattern recognition that I could find in the health literature. This is John Graunt in the 17th century. And he used data from the bills of mortality. This is some administrative data in London. Used that data to find factors associated with mortality. That's pattern recognition. So he published this. This is the data that was using. He was using a human computer. That was all the compute that he has. It was himself with pen and pencil. He was using 2x2 tables and life tables, which is the equivalent of fitting models with maybe one parameter, with 2 parameters, maybe 3. The data were hundreds or thousands of rows and a few columns, and the energy that he was using was probably a sandwich. Anything that you need to just to be able to do this. Okay, if you move forward a couple of centuries, then in the 20th century, you find that people are doing the same thing, but now they are using electronic computers with a few CPUs. They're not using just 2x2 tables, but they're fitting a logistic model with maybe 20 parameters, 50 parameters, way more than we could do in the 17th century. The data is now hundreds of thousands of rows and many columns, and now we have to add some electricity to be able to do this. The task is the same. The scale has changed. If we move now to the 2010s, now the computers are much bigger. They have hundreds of thousands of CPUs and GPUs. Now we have neural networks, early deep learning. We have thousands or millions of parameters in those models. The data is also much bigger now. We have millions of rows and columns, and substantially more electricity is needed. But it's the same task. The scale has changed. So the point that I want to make here is that once we think about one of the learning tasks that we can do from data analysis as pattern recognition, we can see that we've been doing it for a long time from a very primitive way first to something way more sophisticated later. What has changed also is the branding. Because, of course, as these things get fancier and fancier, we start changing the name from statistics or epidemiology to data science. Now we don't use data science, is machine learning, and now almost we don't use that and go into AI. But it's the same task with different names. The purpose is also different because this started as scientific research and has become now a commercial enterprise with billions of dollars. And that also has some impact on how we do this and how we name things. And that also has an impact on the transparency. I can tell you exactly what John Ground was using in the 17th century, what these epidemiologists were doing in the late 20th century. Even in the early 21st century, we still know what the neural networks are, what the models are, what the computers are, how the data are being used. We don't know that now for lots of these things. So that's also a change. So can AI systems do pattern recognition with health data? Can we fully automate this? And the answer to a large extent is yes. We need to define health data, of course, because the raw data that we get from a healthcare system is not amenable to this type of models. It needs a lot of processing. It needs a lot of data management. We have to structure the data. We have to label the data. There's a lot of human labor there. But once that data management has been done, typically, we can feed that into a deep learning algorithm, and it can do it without much human intervention. So let's talk now about the third task, which is causal inference, is counterfactual prediction. So first, we need to specify a causal question that we want to answer. And then we have to generate data to answer that question if we are doing a randomized trial, or to repurpose data to answer that question if we are using a healthcare database, and then we have to analyze the data. So there are a lot of things that go there. So far, we cannot generate data with AI, cannot run a trial. It can repurpose data with some of the limitations that I mentioned, that a lot of the pre-processing so far is beyond what an automated system can do. There is a lot of human labor and knowledge and expertise going into that. But then, once we have that, can AI analyze the data? And to answer this question, we need to keep in mind that the type of data analysis that we do for pattern recognition is different from the type of data analysis that we do for causal inference. And that is key. We do different, it's not the same type of data analysis. So let me explain that. When we are doing pattern recognition or we are mapping inputs to output, when we are doing causal inference, we are not only doing that. We are doing that, but not only that. We also typically need information that is not in the data. And let me show you a couple of examples. So let's say that we have a large database from Medicare with hundreds of thousands of people, and we have lots of information there on who gets a screening colonoscopy, who doesn't, who dies after 6 years, who doesn't, etc. We have a very, very complex, high dimensional data set. We have very good computers. We have very good pattern recognition algorithms from, think of deep learning or any other thing that you like. Okay, can we use this? And can you give this data to a computer and say, hey, I want you to estimate the effect of colorectal cancer screening on the risk of death? So we did this. And what we got was garbage. We got something that doesn't make any sense, because what we find is that people who get colorectal cancer screening have a much lower mortality than people who don't get it. In fact, over 8 years, 6 percentage points lower mortality, which is impossible, because only 2% of people die of colorectal cancer. And even if the screening could prevent all the cancers, which is not possible, but even if that were possible, we would never get to 6 percentage points of difference in mortality. For any epidemiologist in the room, it's obviously a confounded estimate. People who get a screening are different from people who don't get a screening. And there is not enough information in the data to adjust for confounders. There is no information because we don't have data on cigarette smoking, on physical activity, on health-seeking behaviors of a different type, et cetera, et cetera. So it's just not possible. We could have this data for 10 billion people, and we still wouldn't be able to do it. So that is one example. The second example is, again, let's say that we have lots of data and very good computers and very good algorithms, and we want to know whether maternal smoking affects infant mortality. What is the effect of maternal smoking on infant mortality? And we need to adjust for variables. So we can adjust for variables that are associated both with maternal smoking and with infant mortality. If a computer is looking for those variables, we find things like birth weight. But if we adjust for birth weight, we will get bias. We will get actually that cigarette smoking is associated with a lower risk of infant mortality, because now we are adjusting for a collider, which is known as a collider in graph theory. So by using this, by using only pattern recognition algorithms and applying them to data, we run two possible risks. One is that we don't adjust for confounders, because the AI thing doesn't know what is a confounder. It's just deep learning. It's a neural network to find patterns. Doesn't have any particular knowledge about what is a confounder, so we can miss confounders without knowing it, or we can adjust for colliders, which look indistinguishable from confounders, statistically speaking. Therefore, they may be adjusted for thinking. I mean, not thinking. It doesn't think. But finding this pattern that looks like a confounder and adjusting for that variable. So that is why by using only pattern recognition algorithms, we cannot generally do sound causal inferences. And this is now very well known. It took a decade or so for the tech companies to understand this point, that they have fantastic tools for pattern recognition. That didn't mean that they could do causal inference. Okay, so I mean, that's also why data analysis competitions are not a very good fit for causal inference. So the point here is that for causal inference, we need data. We need good data. But we also need something else that is not in the data, something that we could call a causal model, some subject matter expertise about how the world works, about the causal structure that allows us to, as humans, we can determine whether a variable is a confounder or is a collider, or at least have a good guess that in many cases is all that we need. So when we talk about common sense, when we talk about understanding, we are really talking about this causal model about how the world works, which we apply as investigators for causal inference questions all the time. So we have our data, we have our causal model. For description and prediction, if we have the right data and the right task, we may not need a causal model. There are exceptions, but we don't have time to go into that now. I'll be happy to talk about that later. But for causal inference, we need that causal model. So this thing is, give me tons of data and I'll give you an answer. It doesn't work that way. So now there is one way that everybody here knows in which we can get away with the causal model, which is if we randomized. If there is a randomized assignment of the treatment, then we don't need the causal model, because then causal inference becomes pattern recognition. And then we just need to find an association. And that's something that if we can do, we should do it. It's the best way of making causal inference. Of course, that limits the type of questions that we can ask too. There are questions that we can ask, like whether cigarette smoking during pregnancy affects the risk of infant mortality, right? So we have randomization. We don't need the causal model. And this means, OK, but if we need the causal model, how do we acquire that causal model? And there are different ways that we humans do it. One is by doing experiments. In fact, that is what we are hardwired to. From the time that we are born, or maybe even before that, we are doing experiments all the time. We are just saying, if I put my hand here and I do this, I don't fall, OK? So we are doing all these types of experiments to know how the world works, and we have that. So that is one way in which we get the causal model, by doing experiments. Or we learn from other humans. We read books. So if we want AI that can make causal inferences, it has to acquire a causal model either by conducting experiments or by learning from humans. So can AI conduct experiments? Yes, in some cases, yes. And the best example of this is games. We have AI systems that play games better than any human can ever do it. They are superhuman in playing games. But think about that. Playing games is a causal inference task. It's a what if I move this piece here or I move it there. This is causal inference. So there is at least one task of causal inference that machines can do much better than any human. And this is because in this setting, computers can conduct experiments, can conduct an arbitrary large number of experiments. They play games. They play many different games, and they learn by doing that. In fact, they can play way more games than any human can play in a lifetime. So it's the experimentation part here that is allowing the causal inference. Now, the problem is that for many games, the number of possible combinations is astronomically large. So we cannot have a computer that can try all possibilities and learn. I mean, maybe for some simple games or checkers or something, but not for Go, say. So in those cases, we have developed some clever methods of exploring the possible space that doesn't, they don't rely on brute force by trying all possible combinations. And those methods are known as reinforcement learning. So essentially, what we do is that each move has will receive a feedback score. The AI system will play lots of moves, getting that feedback, and then will decide, based on this reinforcement algorithm which moves are better. And by doing this millions of times or hundreds of millions of times, you can have a computer that plays Go better than any human will ever be able to. So this is a combination of experimentation and pattern recognition. You generate lots of data, the right data, for all these experiments, and then that is the reinforcement learning. And then you use deep learning to do pattern recognition over all those data. And the combination of those two things is very powerful. So we don't need a causal model if we can do a lot of experiments. And that is something that we have learned. And I mean, I am now saying this as if this were obvious, but if someone had asked me or many other people 10 or 15 years ago whether this was possible, we would have been very hesitant to say that this was obvious. So this was a technological fit. It was an amazing thing, saying that you can actually do this. You can do reinforcement learning and pattern recognition and have machines that play Go better than any human. That wasn't clearly going. It's not something that we all thought, oh, yeah, this is just a matter of time. So this is very impressive. But it's very important to know that there are these two components for causal inference. So if you take this to the extreme, then you start having this new learning task of causal inference that is based on supercomputer, hundreds of thousands of CPUs and GPUs and billions of parameters in the neural networks. But now we are combining the pattern recognition component of deep learning with the experimentation component of reinforcement learning and lots of data and lots of energy. Now, this worked for games for the reasons that I said, but also because we have perfect information. In games, you are playing Go. If you know the position of the pieces on the board, you have perfect information. That's all that you need. So this works when we have perfect information, when we don't have essentially any practical limits on the amount of experimental data that we can get, and when the causal model is known, the rules of the game are known, or they're simple enough that they can infer from the data, which is what happens in many other things. So if these three conditions don't hold, it's not clear that we can use these tools in such a successful way for more complex causal inference questions like the ones that we have when we use healthcare data. So there may be a limit to what this can do. And we cannot do this automatic reinforcement learning, which means that the causal model to do this needs to be acquired in a different way. And well, as we said, humans acquired a causal model from other humans, from non-causal, from data that are different from the data that's being used for the study. So maybe then that's what machines can do too. If humans can learn from other humans, then can AI learn from humans too? And that is what language models come into the picture now, of course, and all this type of models. So learning has a different meaning because, of course, we have a different hardware, humans and machines, but it's kind of the same idea. Can we acquire a causal model? So I like to use this example just to give an idea of how this happens. This is a very old version of ChatGPT. It's 23 or something. So in February of 23, I went to ChatGPT, I think it was 3.5, and I said, Miguel was alive at 5 p.m. and also alive at 9 p.m. Was Miguel alive at 7 p.m.? And he said, it's not possible to determine with certainty whether Miguel was alive at 7 p.m. based solely on the given information. Okay, that doesn't look very promising. And then says, Miguel could have been alive at 7 p.m. or he could have died at some point between 5 p.m. and 9 p.m. Alternatively, and have been died and brought back to life, etc. Okay, this is not a very good answer. Okay, this wasn't a very good answer. So I said, well, Miguel was not brought back to life during that period. Was Miguel alive at 7 p.m.? And they say, well, if Miguel was alive at 5 p.m. and also alive at 9 p.m. and he was not brought back to life during that period, it is reasonable to assume that Miguel was alive at 7 p.m. Of course, this assumption is based on some bullshit that comes there. So this is not very good, okay? 3.5. But, okay, this is what, this is a very old version of the model. Of course, I will show you what happens now. But this is based on a very large neural network with some reinforcement learning. But the reinforcement learning is not automatic anymore. It's not we are playing experiments, the computer against itself, playing experiments. Now the reinforcement learning comes from humans. So the way that these models works is that the companies hire thousands of, we don't know how many because this is not public information, but most likely thousands of humans for these things. They hire to interact with the model, and they score the responses that the model gave. And when this is not done well, models go, I mean, there are lots of cases in the media that you can read how models start to give very sexual answers or violent answers, or the model starts to try to convince the person to leave his wife because the model is in love with the person. All these weird things that happen, that's when there is no good reinforcement learning from humans. But by doing this a lot of time, the role of the automated reinforcement learning in games is now played by humans. Of course, this is very expensive, it's very labor intensive, and it scales very badly. But few months later, I go back to the same version of ChatGPT 3.5, the same version, same neural network, same pattern recognition, same deep learning. And I asked the question, on Saturday, Miguel went to the movies at 6 p.m. and went back home at 8 p.m. Was Miguel alive at 7 p.m.? Yes. That's it. That's what human feedback does. After more months of human feedback, the model is the same, it's using the same data, it's the same version of the neural network, but has more human feedback. And now it's acting more like a human. So in fact, when I asked how did you conclude that, it gave me a very reasonable explanation. It looks like it understands what is going on. Okay, so this is what humans do. And there are lots of issues about how humans have been mistreated to do this in many countries, but that is a different story. So when we talk about AI today, some people talk about the pattern recognition component only. They talk about deep learning, which is a type of data analysis for task number 2. And some people talk about this combination of deep learning and reinforcement learning with or without human feedback, which is what we are when we are talking about when we talk about these language models. There's another component too, which is that for these models to work well, possibly they don't need only the data and the pattern recognition in language plus the reinforcement learning with human feedback. They probably also need rules that are given to the models. And we don't know how many rules. It is very, we don't know what is the relative weight of data, human feedback, and rules in how these models work. Anyway, there is an arms race now, as you know, and we are spending, as a society, lots of energy to run these models. Even entire nuclear plants are being opened just to run these things. So we've gone a very long way from John Brown's sandwich to something that we can have a computer that has about 10% of the current electric output of the US. And the stakes are very high. We don't know how much energy exactly this is using. We know how much water exactly this is using. There are some guesstimates there, but this is non-public information. So back to AI, I'm going to finish here. If we see AI as this set of tools for data analysis, do we have all the tools that we need, really, to keep moving forward in a way that machines will be able to do all this data analysis by themselves? And some people say yes, and some people say no. And I don't think anyone knows at this point. Clearly, things are not going as fast as they were going 10 years ago, but it's still pretty impressive, many of the things that I'm doing. So I don't think that we know exactly, I don't think that we have reached the limit of the current approach of deep learning plus reinforcement learning with human feedback plus rules, but this is really an open question. I think it helps to think of this question with a structure that doesn't treat AI as some completely new thing that is separate from all the data analysis that we have done in the past. So as I said, this is very hard to assess. We don't know exactly what the limits of the technology are because this is not explained to the public. And that is a very new thing in science. It's not very often in science that we have had scientists in independent research centers not being able to assess how a technology works at this level because they are completely spent by the big companies. So we have very little scrutiny, really, of what is going on. As I said, what is the role of the data? What is the role of the human feedback? What is the role of the rules? How all this works together? We don't know yet. So that is not science as usual. So on the bright side, AI is not going to take over the human race anytime soon. We don't have this super intelligent machine that is going to do that. It's a very sophisticated form of data analysis that combines data from different forms. So when we use it for causal inference, we will need to continue working on how we integrate the pattern recognition deep learning algorithms with the reinforcement learning, with the experimentation part, or the human feedback. And for any data analysis, the results will depend on the quality of the data and the quality of the analyst. And I'm going to stop here. I'm happy to take questions.